Don't talk like. Okay, we have a sign-up sheet if anybody wants to speak, because we're going to start off with that first. It's right at the desk. If anybody wants to have their say about this. You signed up? Okay, you did. Okay. All right. Hey, good morning. Oh, okay. Thank you very much. Thank you, Dr. Al, for coming. Okay. Well, it is summertime. We'll call this meeting to order. This study committee, it is our last one. We're going to take public comment and then discuss things that we have, maybe possible recommendations going forward. It seems like that it's, we talk about smoking over and over again, and it continues to be a major concern especially for those of us that are in the medical profession, like Dr. Al, or have been, and then just people who've had family members who have been affected by smoking, or I truly believe secondary smoke. I am a registered nurse. My husband was a family practitioner. Neither one of us ever smoked, but my husband died from an illness, no known cause, no known cure, which affected his lungs. So I watched him have trouble breathing. And I had a sister die during my first campaign, a younger half sister, who, here again, hypertension of the lungs affects especially young women between the age of 30 and 40, no known cause, no known cure. But I had a stepmother that smoked all the time. And I've often wondered if that is what affected Sylvia and her death that came at such a young age of 36. So it's always been something with me as I got into the political life and realized how much money and how many people on our Medicaid program that we are responsible for their health care. How many of those illnesses relate to smoking? Maybe they've quit 30 years ago, and then as they got older, they suffer from the effects of smoking. I've also seen the insides of lungs and in autopsies and know what a smoker's lungs look like. And of course, Dr. Al certainly would like everybody to have picture perfect lungs when she puts them to sleep. And unfortunately, that's not the case. And your lung capacity certainly can affect your outcome on a surgery table. So it is a big concern. Hopefully we can be innovative and find something that we might go at it that's a little different that might pass. Well, so with that, I'm going to take public comment, and I have Dr. Miller come forth, and you can either sit or you can talk from right
here,
right there. What you're comfortable with.
Yeah, well, thank you very much for allowing me to be with you today. I'm a thoracic surgeon. I practice in the Medical College of Georgia in Augusta. I've been in Georgia practicing thoracic surgery since 2002 when I was recruited to Emory as chief. And great run at Emory, but going to MCG, I thought I'd bring a lot more to the table for what we don't offer in the rural part of the state. I'm professor of surgery there, director of the lung cancer screening program. And I'm glad to say that in January, we're going to have our first mobile screening unit in the state for lung cancer. It will go through Public Health District number 6, and which is 13 counties in that area, and we will screen for lung cancer, coronary artery disease, emphysema, obesity, hypertension, diabetes, all that in 15 minutes. And that will help cut down, that will screen for 7 of the top 10 causes of death in the state. As you know, Georgia ranks last in total health outcomes. We're last. We are last in access. We're 51st. They include the District of Columbia in there. So that's one thing we've got to remember as we talk about tobacco. In the state, we have 11 million people. 6 million of those people are in metro Atlanta. The other 5 million in rural areas. And we talk about screening for lung cancer. There's 150 sites. 130 of those are in metro Atlanta. The other 20 are in the rest of the state. So there's a lot of issues with that. My main thing in Augusta is smoking-related diseases. As you know, there's 250,000 lung cancers a year in the United States. 40,000 of those are secondhand smoke from parents, spouse, workplace. Unfortunately, we're finding that more frequently. The big thing that I'm here today is talk about how we can improve the care of our patients from access, but also in regards to financial incentives. As you know, the cigarette tax has not been changed since 2003, when Sonny Perdue went from 12 cents to 37 cents. We're the second lowest in the country at 37 cents. The average is $2. The highest is New York at $5.25. Right now, there's 20 cigarettes in a pack. If we would increase that tax to 10 cents a cigarette, that would take us up to the national average. And that would increase the amount of money that comes into the state from what we get from tobacco tobacco tax now of $450 million. It'd get up to $1.2 billion. As you know, our federal funding for Medicare and Medicaid is going to be decreasing somewhat. So we've got to help our state and help the generations to come. As you were talking about breathing, when we breathe 25 to 28,000 times a day. So we're always exposed to outside elements. And that's why people can develop pulmonary fibrosis or different things that can cause that. So the main thing we want to look at is also in regards to vaping. As you know, that's a big epidemic in the state now. The cigarette smoking, only about 15% of adults smoke now, which has been a tremendous reduction since the Korean War of 45%. But vaping use goes up 2 to 3% per year. The big thing with that is our young adults. 1 out of 5 middle school students vape, 1 out of 4 high school students, and 1 out of 3 college students. Problem with that, during that age of development, they get so addicted to the nicotine. A cigarette has 2 millimeters of nicotine in it. One vape has 50 milligrams of nicotine. So it's 25-fold. And so what that does, that gets them to craving nicotine and so forth. The big thing is flavored vapes. There was 200 lung transplants performed in the U.S. last year from injuries from vaping, from the flavored vaping. The reason that is when you have a flavor, the flavor capsule is in a glycerin capsule. It's like a fat capsule. And as they inhale, if the coil doesn't melt it, they get lipoid pneumonia. And lipoid pneumonia is non-reversible. So that's why flavored particles is a major issue. I looked online today. I'm sorry.
No, I've had bronchitis for 2 weeks, the first time in my life, and it's affected my ears. Can you go back and I really didn't hear all about the capsule and what the problem was. I'm sorry to interrupt.
Oh, that's great. When you have just nicotine in the vaping product, it's just pure nicotine. There's no flavor. Okay. But when there's a flavor, there's these little particles. You remember the 12-hour contact capsule years ago that had all those little micro BBs in there? Think of that like a flavor capsule with fat on the outside. And when it goes through the coil or the heating device in the vape, it breaks that capsule down so the flavor goes out. Well, those products are not regulated and it can be faulty. So those capsules don't dissolve and that fat goes into the lung. When the fat goes into the lungs, it causes lipoid or fatty pneumonia. You cannot reverse that. So that's factor for, and then you develop pulmonary hypertension and develop lung failure and so forth. So I looked online today, and we see this from our patients, is that the number one flavors out there are strawberry, mango, melon, and number 5 in the state is chicken and waffle. And they have creme brulee, they have vanilla ice cream. So, but it's for young adults. But, young adults can't buy that because they have to be greater than 21, but they're getting access to that. So if we're going to increase the cigarette tax, we've got to increase the tax on vaping too. As you know, we're only 7% tax on vaping products. The highest in the country is Minnesota at 95%. I know there was a resolution in, I think, at House Bill 192 that looked at going from 7% to 15% in 2023, but that never went to committee from my understanding. That's correct. So if we would go up to 50%, we would bring in an extra $2 billion a year in related to lung-related health issues. And if we would ban flavored vape, and also if we ban menthol cigarettes, which is what people crave, we would make a big change for our people in Georgia, our Georgians. And what that does is that helps generations on down the road. As I talked earlier, every 2 hours, someone in the state dies of lung cancer. Every 3 hours, a Georgian dies in the state from COPD and emphysema. Okay. I'm sure I gave you a lot of facts.
No, it's fine.
But
Thank you.
I live this every day.
Right.
And so as a thoracic surgeon, and especially in Augusta is considered rural Georgia until 1 week out of the year when the master's there, and then we're not rural Georgia anymore. But all the other 51 weeks of the year, we are in rural Georgia. But we've got, the big thing is access, minority population, which is almost 65% in Augusta and so forth.
Yeah. Well, no, it wasn't too fact. In fact, it was very good. Sometimes, we say, oh, we've saved the best to last. And I think we may have. And I really appreciate you coming and taking time away from your work in Augusta. So, no, I think it's important. First thing is, will you please bring your mobile screening unit to the Capitol during session?
Yes.
You get to park it out here, and will you do the screenings for members?
We will. And the big thing, you have to qualify. You have to between the age of CMS and the insurance now is between the age of 50 and 80.
Oh, well, we have a few people like that.
I wasn't going to comment. Let's just call the senior class would be involved in that. But you have to have smoked at least 20 pack years.
Oh.
Okay, you have to be asymptomatic. But what they're trying to change is instead of pack years, they're trying to say just to smoke for 20 years. And that will capture about 50% of the cancers here. The scan is 12 seconds. Scans from your chin to your belly button. And it captures everything. 40% of the patients that we screen, we find other things. Breast cancer, aortic aneurysms, liver disease, kidney disease. So it's an all-inclusive, and the radiation exposure of a low-dose CT scan, 1.6 millisieverts, is the same as sitting next to somebody on a plane for 6 hours.
Okay.
So it's not increased. But also you can self-pay for $90. So if there's some congressman, congresswoman or something would want to get their screen, we can do it at the same time. But also we're going to check height and weight for obesity, blood sugar for diabetes, measure blood pressure for hypertension. We're going to do a head and neck exam. So if you don't look for head and neck cancer, you're missing the other smoking related disease.
Hold on a second. You think we can get people to take advantage of it enough?
I think so. And we'll talk offline about this because we actually already have like a model in place and that we do a blood drive twice a year during session. So we already have it down in terms of working with the building, where to park and,
Everything.
so we'll help you with that. I think there will be some uptake. It's probably, there's a pre-screening, so it's not going to be everyone, but people here definitely smoke.
Yeah.
Any way to give a special price to that $90 off that we could run a?
Well, it's interesting. We were doing it for $11 on Veterans Day, especially in Augusta because we got Fort Eisenhower, whatever the name is today. But $11 was that, but CMS said we couldn't do that because we were undercharging CMS. But for an event, I don't think there'd be a problem. And it's read remotely. When you leave that unit that day, you will have your result.
Well, I
That's
think,
the key.
I don't know how many people we have that smoked 20 years. I mean, because it's really been a push here at the Capitol, and it's non-smoking area and stuff. So I really don't know how many people even continue to smoke. But if you pick up the other things, and we could just have people that are under 50 that might want to pay whatever it is, like $45 or $50 maybe, or
that would
something
be
like
great.
that we might be able to do it and let legislators know they can be checked, let them see what can be done, see the value of a mobile unit like this and how we can get it. If other rural health areas would take it, they say a picture's worth 1,000 words.
Well,
And sometimes we have to really show our guys that a picture to get through to them. They're really great. They just come, they're farmers and insurance agents and all sorts of people that don't deal with health problems. And, a lot of them don't go to doctors regularly. And sometimes they just need a little.
And it's usually the people with the Y chromosome that don't go to the doctors.
I know.
So as you know how that is. So
Georgia is now one of 2 states in the country trying to push basically pre-screening with a little dancing kit to try to pick up people who need to have a colonoscopy, especially in rural areas where the access is. And I just heard a report on it, and they're trying to get to 300. They're over 100 in a fairly mostly women.
Yeah, exactly.
Even though they're trying to push it.
And
it's the kit, and it's not hard, and it's don't.
And the big thing, the American Cancer Society is also pushing their project called Pink and Pearls. So for screening of lung cancer and also breast cancer. So we have a mobile mammography unit too. And when we go out, we're going to do that also because we're going to do it at the public health departments in our public district. And then MCG has a relationship with 22 of the county hospitals within Southeast Georgia. And it's called the virtual network. And we're going to screen at those places too. But the one issue when you go to a plant to screen, as you know, if you smoke, your insurance premium is higher. So a lot of patients won't come out and get screened because their employer will see them that there's. Are you a current smoker? No. So a lot of times we'll give the cards out and we'll get a call the next day. Where can I get this screen that it's not at work? So it's about 20% of patients that we see for that. So it's interesting.
Okay. I'm sorry. Representative Al.
I think thank you so much for talking about this mobile screening unit. I think that's a great idea. And the added benefit actually of bringing it to the Capitol is not just screening lawmakers, it's showing lawmakers that they might be interested in bringing the mobile screening unit to their districts, right? So that's a great way to touch a lot of people who can generalize this.
So in that, because, MCG, we're the 6th largest medical school in the country because we have these other satellite campuses, Brunswick, Albany, Athens, and up in the Dalton area. So eventually we want to have a mobile unit out from those areas so that we can get the whole state.
Right.
And so that's what's going to be great. And so that's
local hosts to come.
Exactly. Yeah. And then like Phoebe Putnam will take care of those patients there. Piedmont will take care of the ones in Athens. Brunswick will be Savannah Memorial. So you're spreading the healthcare. It's not they all have to come to MCG, which would be impossible. So you want to be access close for patients to do that. And they can get linked in with them. Also, too, they have to go through a stop smoking program also. So it's interesting. I practiced at the Mayo Clinic before I was recruited to Emory. We did the first study of lung cancer screening in the country. And when we screened patients, 12% of the people who were screened and didn't find a nodule, they started smoking again. So it's just like, well, why are you? And this is not a one-time test. This is a test every year to the age of 80. Also, too, we use an artificial intelligence now that gives us a lung cancer predictive score, and it's 92% accurate because in the South, we have a lot of histoplasmosis, granulars in our lung, and sarcoid from bird droppings and so forth. So we can't take all those nodules. So AI has worked out very well for us also to cut down on costs and also to expedite care if it's needed.
Well, there are only 3 of us here. But this does go out across the state if people are watching, and we try to push that. And I thank you for talking about the medical college. And, we are proud of that. My husband did graduate from Emory. He was accepted at the medical college, but he already had jobs here, and he was so poor he thought he better stay where he already had jobs outside the medical school. And at that time, it didn't cost as much to go to Emory when he went. But we have really worked hard here in the legislature to get more money to the medical college so that you could expand. We are working hard to get the word out that we are working hard to get people access all over our state, quality access. And I really appreciate what the medical college has done. Telemedicine has helped in our rural areas where if they don't have a cardiologist, they can contact a cardiologist. And I'm sure that's probably the same.
Well, and it's great
lung.
because a lot of times the patients don't have a computer at home to do a Zoom meeting or telemedicine. So the family practice office says, hey, you come in here to my office and we'll set you up and you'll talk to MCG about this. That's been fantastic. And the family practitioners in the rural area, they love that because their patient is being taken care of, and it allows us to, expedite things when it's possible.
Yeah. And the other thing I'm concerned about, I was in a meeting yesterday when they were talking about public health, and there was somebody out in the audience who wanted to say, there are 2 million Georgians not insured. You didn't expand and she didn't come to me but she was disagreeing with me because according to the people who run our area that covers Medicaid and trying to get people, the way we did it is that we did it the Georgia way. We didn't just do an expansion of old-fashioned Medicaid. What we did was, through the Affordable Care Act, there was provisions for low-income people that were not being taken advantage of. If you were 101% to 150% of the federal poverty rate, you could pick a healthcare policy through the Affordable Care Act, and it didn't cost you anything. So what they did, the state tells me that they have signed up over the last 2 years. They have signed up, I may reverse the numbers. I think it's 700,000 Georgians on that 101 to 150 level where they don't pay anything. They have also helped sign up 800,000 for people that were at 151 to 400, where they get a policy and they can choose, one, and that they pay a small percentage of their income, 1%. So they are telling me we now have over 1.5 million Georgians that have insurance policies just like anybody else. And that on the state program pathways where they have to work if they're able-bodied.
Yeah.
Able-bodied.
Yes.
And that work, quote, can be going to school. There are exceptions if you have cancer or an unusual circumstance, and they have something that's not even listed, they can appeal it. They can be a caretaker. Are you not seeing that at the medical college? People coming with more insurance policies?
They are. It's interesting. For 9 years, our screening was for free. We're us and the Leahy Clinic in Massachusetts were the only one. And 82% of the people that we screened had insurance. But it was a free program. But we couldn't after CMS came in and said we could do it. But what we're seeing is exactly what you're saying. And they're actually, because they finally have insurance, they're finally getting that colonoscopy. They're getting that mammogram. They're getting their lung cancer screening. So they're involved in the system, and their spouses come, or an uncle or an aunt. So what we've done is that we've had a multidisciplinary clinic, especially for lung cancer. And when they come to clinic, there's 4 doctors, thoracic surgeon, pulmonologist, medical and radiation oncology. They see all 4 doctors at the same time. So our time to treat has gone from 42 days to less than 14. Got somebody coming from Dublin or Waynesboro, wherever, more quality care. But they want to find out what's going on. And so it's improved our care, but it's one person at a time. So that's by mobile and going out to the people, we have to do that.
Well, I'm getting really tired because I don't believe that the department's going to lie to me. I mean, I've taken them on lots of departments over it, and I the person didn't come up to me yesterday. I wish they had, because what I would have said was, could you show me those 2 million people that are uninsured? Where are they? And if they're out there, because when we did this, and people don't understand, there were places in Georgia where we had no insurance coverage, and they didn't want to take the Medicaid patients because they were afraid they would be high cost.
Yeah.
And so the governor had to sweeten the pot by putting in millions of dollars to, say, if you have an unusual amount of catastrophic illnesses, you've got this backup. And he did that. And so we finally got where we could offer the insurance policies across the state. So we started with that, and then they started signing up people because we were in court, with the Biden administration over the Pathways program, where you're 100% or below that, and we could have a work requirement. So while they weren't waiting, they were signing up people for policies, which takes away a lot of the discrimination also.
Definitely.
And the other thing it does is that it pays better for our rural doctors than our Medicaid program. So it was a win-win situation for us. And I'm just getting a little tired of people. So I'm glad to know that you're beginning to see more and more people use those policies. And I'm on my high horse because of the person yesterday that was gunning for me. And I keep hearing it. No, we did not do and expand regular Medicaid.
Yeah.
We did a Georgian program, which we think is the better way to go. It adds dignity to people with their own policies. So they're not saying we're on a state program, getting something from the state. So there's dignity to it. It pays better to our doctors, which helps us get more doctors in rural areas and helps them stay afloat. And there's just, and somehow or other, people like to keep, saying that we haven't done it. And what I want is for people to bring me those uninsured, and I will go to the department and say, excuse me, you missed a great deal of Georgians. Let's get them signed up and get what they need. So sorry that I do that.
Fine.
Okay, who else wants to? But Debbie, you got anything to?
Yeah, I do actually.
Sorry.
This is going back to the mobile unit being for people that are smokers. Is there a way, and I think that's the primary target, and I'm really excited about what. Is there a way at some point down the road, maybe where it could be opened up and we could see and measure if you've been exposed to secondhand smoke? Say you're the spouse of a smoker and you've never smoked.
Yeah. So right now, insurance companies, CMS, only pay for the high risk patient, but there's a moderate risk is if you have a first degree blood relative who has a history of lung cancer or head and neck cancer, or if their pack years were great, your exposure was greater than 20 pack years. It's going through the, what is the Uniform Services Preventive Task Force, going through that now, because that's what helps us set CMS to pay for it. But that's the second moderate rate. But being in the state of Georgia, we can do whatever we want. If we want to screen those moderate people and pay for that, and so we're improving the care. Also, too, in the mobile unit, people love the idea. They want to be seen on Saturdays. They work Monday through Friday. Saturday, you go do that. You get the same care and so forth, and you'll get more people to come to that. Nothing except for on Georgia football weekends, but yeah, exactly. Yeah. Maybe on something after church, we could do after church. But I think that's a very good point.
Thank you.
Okay, so is there any research, or have you ever heard why Georgia, other than we don't, Republicans are now the majority party, like to add taxes onto anybody, why there is such an aversion to adding it on to an industry that costs the state so much money.
Mm-hmm.
I mean, I almost would see it not as a tax, but as a user fee, because the chance of you smoking on down the road years later, we're going to pay, the state is going to be involved in paying for a lot of it one way or the other. But there seems to be, we are not, I'm a Texan by birth and a Georgian by marriage. When I first came and started in the legislature, I would have thought that we were a huge tobacco growing state. We're not.
We're 6, but
Okay.
that's a very small number. Kentucky, North Carolina dominates. We're 6 in the United States, but it's a very small amount.
And I don't understand why
Yeah.
that we have such a commitment to keeping it so low. I mean, I am proud that I got to vote for it under lots of people, saying, "Oh, don't vote for when we did raise it as best we could." I got to help move the bill that helped decrease smoking as much as I could. At the end of my career, those are going to be, what I'm going to look back and think is major accomplishments. But there just seems to be such a religion.
And there is great data that by increasing the usage tax, it did decrease smoking.
Yeah.
It is that we don't have that data for vaping, but we need to nip it in the bud before it continues to grow.
Okay, do you think, sometimes down here, we have to do things bit by bit and find ways to work around things. Would we make a major difference? And I was thinking about this from one of Representative Al's suggestions. If not raising any taxes this time, and if we outlawed the flavor,
Flavored.
would that make a significant, would people quit?
Yes, because
You're-
85% of the vaping products are flavored.
Okay, I know.
So that's huge. That's huge.
Got it. Okay, so that if out of this committee, if we maybe had a major suggestion, going into an election year, when everybody's talking about decreasing taxes, not increasing them, or lots of people are, that would make, and you're right, if we could get something like that through, it would be a major change.
There's 5 states that have that now.
Who are they?
I want to say Colorado's one. I think Wisconsin. I'll get you the other one. I think Nevada and so there's 5.
You got the list.
So can someone Google that real quick? You may got the young people back there. Can you get in there, Dr. Google? I think there's 5 states now that ban it.
Says she's got it as usual.
There's 5. And so, but that would make a major impact. And also too, that wouldn't be affecting the voting public. That's middle school students and high school. They don't vote yet, so they wouldn't affect you in the election.
Well, I hate to say,
Just kidding.
but sometimes that's saying that they accuse people, if it's for the children, we can sometimes get some things through that maybe don't go through otherwise. And the statistics that you gave us about children and vaping and all, I was shocked recently, and it wasn't the Cobb schools. We have the city of Marietta in Cobb County, and they are spending several $1 million putting vaping detectors in their bathrooms and different places like that. It's incredible to me that we have, our school systems have to,
Thinking.
huh?
It's end of pipe thinking.
Right, and to have to put it in there to try to curtail the smoking issue. So seems like that money could be much better used. And the city of Marietta has a great education system, but I'm sure they can use the money. Representative Dow.
So the list of states that have banned flavored vapes, I don't know if you're going to like this list or not, but that's what it is. There's 6 of them. It's California, Massachusetts, New Jersey, New York, Rhode Island, and the very conservative state of Utah. So
There we go.
that's cool. Right?
That's a,
We should do that.
It's interesting. There's no one in the Southeast, so we would be the first tobacco growing state to do that.
Pioneers,
I
leaders in the industry.
just bet if we can get that type of bill to a committee, that you might be willing to come back and testify if we gave you some
Definitely.
money.
Definitely.
So, like that, I
We'll
think.
hold you to that. That's
I think we'll
good stuff.
pass around the chicken waffle one so they can taste it in the rooms or what's that?
Thanks.
I know I'm on a rampage about a lot, that, and also maybe the medicine I'm taking for my bronchitis and all, and no sleep. But this is something that's so important to me. I have never smoked. My real mother smoked before she died. I don't She died when I was 12. So I don't have memory of her being a chain smoker or anything, but my stepmother, smoked incessantly. And I was appalled by it as a young
And that was in the days when
women.
there was no air conditioning in the cars. You go on, there was a big long trip and they open up the car door and it's all smoke and race, and so your exposure is incredible.
And that was still a problem when we did make the changes that we tried to make, is that we wanted to say no smoking in the cars. That's the car's your private domain and you should be able to do it. Michelle, go ahead, Michelle.
So just to recap, thank you so much. You've done a really good job of framing some policy priorities because this is our third committee meeting. First one was smoking, second was vaping, and this one is the policy recommendations. So just a couple of things to recap is I really love committees like this because it shows that on both sides of the aisle, there's a commitment to the priority of increasing healthcare access for everyone.
Right.
That's
I mean, we're
clear.
trying to do it.
Increasing access to insurance. I will note that some of that 700 to 800,000 patient increase in coverage did stem from the enhanced ACA subsidies that were passed in 2021. And I do not want to lose this progress we've made that we've seen if those enhanced subsidies go away by congressional votes. So that's definitely something.
No,
we
I'm
can
thinking
continue
positive. I'm trying to be
So we'll
positive.
continue to watch that, but it accounts for a lot of that increase, that great increase that we all agree is awesome for our patients. So just to put that out there. From what I heard from your testimony, you have 3 policy priorities that you think are worthwhile for the legislature to pursue. First one is increasing the cigarette tax, right? Look at HB 83 from this session that increases it in a modest amount that I think is palatable maybe to some people. And we can always tinker with that amount, but it's to get it started. I don't think that, I think that Chair Cooper makes a good point that it's been more difficult to move a bill like that because anytime you say the word tax, some people freak out. But there's no reason that we have to continue this commitment against something that makes a lot of fiscal sense for the state. And I think we can decide as the people who are talking about it to chip away at that commitment against it.
But
And
timing is everything. I mean, sometimes down here.
yes, that is definitely true.
Not a-
Increasing the vaping tax is something that you mentioned. I think that also makes sense. Look at HB 84 from this session. That proposes
From
to raise
7
it
to 15.
at 7 to 15%.
Yes.
Right, which is in line with the national average of other states. So that's good. And then the third thing is banning flavored vapes,
Yes.
which is something we also heard from our community partners at the American Lung Association and that we've seen in some other states, as we noted. That is something I think that makes a lot of sense and targets the fact that when you are selling a product that is flavored like gummy bears, it is clearly targeting children.
Exactly.
I don't think there's any way that you can spin your way out of a blue raspberry spelled with 2 Z's flavored vape and say that it's
That's right.
for smoking cessation for 80-year-old grandpa. Like that's just not.
That's why Juul was taken. They started in 2015, 2012, they had that ban, but they've come back with different products, different delivery systems. So they've worked the system to get back in there. But yeah, there's so many flavors. It's incredible.
Right. So I think these are 3 very doable,
Yeah.
concrete policy pieces that have been demonstrated to have a real health effect. So we'll continue to work with you.
And a statewide lung cancer screening program,
Yes.
mobile.
Well,
Because MCG, I tried several entities to get a mobile unit. I was kissing babies, shaking hands, all that goes for about 3 years. MCG finally said, we're going to do it. We're going to pay for it. We're going to no outside, not Wellstar, not Piedmont, whoever. We're going to do it because they know it's going to help our patients.
Yeah.
And so they've stepped up to that. And so now the rest of the state, that can be helped out by the people here on Capitol Avenue. So we'll see how that goes.
or maybe we need to get Emory and Mercer. They're all doing really good things, but
Well, it is.
Piedmont, maybe, if it's really helping, maybe we need to.
Yeah.
I mean, sometimes the state just needs to get out of the way. You notice we didn't start that, y'all did.
Yeah.
And a lot of good things that happen to help us don't come from us. Sometimes we just have to change the rules. Like one of the reasons we're having trouble getting our kids that need it so badly their teeth cleaned in school by a dental hygienist is because there has to be a covering physician within 50 miles in case something happens if a dental hygienist cleans somebody's teeth. Now, the chance of that happening, that it would be necessary to take that child to the dentist right that minute, are probably 0 to
Yeah.
1/100th of a percent. But that keeps us from having a dentist, perhaps at a federally qualified health program, 60 miles outside, being a backup dentist. And our children go without dental. That's the kind of thing the state can try to change, and we have. But
And that's why the Lung Cancer Roundtable that I'm chair of, there's 35 members and they represent private, university, public throughout the whole state. So we've been in 2017, I think, when the round table started. And so it's a great organization. We meet twice a year. And we're addressing this at all levels, Gainesville, Morehouse, Grady, all that. So,
well, and I think coming to the Capitol maybe would give you some emphasis on how important we think it is, that other people see it. And you might invite some of those people that were nearby to come by the Capitol, while it's here. Go ahead.
I apologize for jumping in. I'm Lynn Durham from Georgia Core, and I'll just say that as part of the House Study Committee on Cancer Care Access that Lee Hawkins is chairing, one of the recommendations that we haven't seen the final recommendations come out of that, are more mobile units and some one-time funding from the state for mobile units. So I'm sorry that he's not here today. I know he's a member of this committee, but we may see if there's some alignment.
Right there. I just know that the budget the governor so far has just told the people in the different departments, I understand, to keep the budget level. Huh?
Yes.
No new programs, I guess, to start with. So that's why I'm just a realist, and
well, and also just one thing about the cigarette tax, in a usual pack of cigarettes, there's 20 cigarettes. So going up to 10 cents each, but now 15% of the packs of cigarettes in the United States now have 25 cigarettes in them from Canada, Costco, Sam's Club, they're Marlboros. So now so when we're calculating pack years, do you smoke the one that has 20 cigarettes in it or 25? But that's, Canada and Europe has 25, and it's coming more and more into the US in these, secondary places. So that's why the tax, 10 cents per cigarette, $2 on the regular, $2.50 on the big one.
I mean, there's so many things that come for you. This is not one. Sort of let Dr. Al do all the research. She's in this. In Europe, are they still much heavier smokers than we are?
Yeah.
And how is their cancer rates? I mean,
their they are not as big a screening as we are in the US, because we have that big study that was sponsored by the NIH and CMS that showed a difference. When you screen with CT scan, you decrease overall mortality by 20%. That's more than mammography, pap smear, colonoscopy, and PSA all combined. Because your lungs have your lung findings, your nerves of your lungs are very immature. And so if you have a nodule growing in your lung, you don't feel it until it gets to an advanced stage. And 3/4 of the patients in Georgia present with an advanced stage. 20% of our Georgians do not get treatment for their lung cancer because it's already too far advanced. So about we pick it up early, because as you know, 80% of your total healthcare expenditure in your lifetime is the last 6 months of your life.
right.
That's usually because of advanced cancer and things like that. So if you find it early, it makes a big difference.
Are you at the medical college? Are you using the robot? There's a new robot.
Yeah, the ion.
Done by one of our companies here that can go down into tiny little parts of the lungs to get, without it being so traumatic.
Yeah, that's to get a biopsy to confirm. It's really nice. It's like the Nintendo game. You got a little ball and it tracks it down. And so it's been allowed us to biopsy more things. And also too, what we've done now, we'll do the ion robot. If it's cancer, the cytopathology, look at the same time, I'll go ahead and take the lung cancer out. So
Right.
one-stop shop.
One-stop shop.
Yeah, which is perfect. You don't have to put the patient to sleep twice. You don't have to wait 2 weeks to get the results back. So it's been incredible. So the ion robot's been out for about, I think, 12, 13 years. So it's working.
Yeah, I mean, I watched the Georgia company demonstrate the new one that
Yeah.
was so able to go in the smallest parts of the lung and make it a one-stop thing. And it's amazing. And it's a Georgia company. And I'm glad to see, Georgian innovators,
Yeah.
doing
Yeah, no, it's
things.
been a great advance because, you expedite their care and a patient, cut down on morbidity, mortality, and so forth.
It's less traumatic. So, I mean, because I think one of the things that cancer patients fear is really just huge, excessive amounts of old-fashioned surgery where they're
Well, and the
They're like-
biggest thing that I have to talk to patients, they go, if you open me up, is my cancer going to spread
Yeah.
everywhere? I have to go through that every day. If that was the case, then we would reverse hyperbaric chambers to treat cancer.
Right.
We're done.
so. Any other questions? What?
Chairman Steve.
Oh, Chairman Stevens, I'm sorry, I didn't realize you were on. You got a question for the doctor?
Yes, ma'am. Mainly, one of our recommendations I hope that we come out of is that we, as I mentioned, if we can't get folks to go along with an increase in the excise tax that we charge, that we at least at minimum move the sales tax associated with all of these products over to the excise tax so that we can fill the gap in some of this $500 million that the taxpayers of Georgia straddle with to subsidize the cost of health care that these products cause. And just as a side note, Madam Chairman, it's kind of personal to me. Last night, my wife got a call that her sister had passed away, and she started smoking in the early 70s, all the way, heavy smoker, all the way through until she got sick. And everyone, if you smoke long enough and hard enough, you're going to get sick. She passed away last night. Didn't have a quality of health for the past 2 decades at all because of the smoking related illnesses. So it touches a lot of families, and I just wanted to pass that along, that we really, the taxpayers, number one, don't deserve to subsidize these products that cause the illness that damages families. And it's personal to me. And as you know, I've been doing this for a long time.
Yep, even before Dr. Al, you were, championing this, and I thank you for that. And please tell your sweet lady, send her our condolences about her sister. I'm so sorry, because I've watched people die and it's not good, and I am really sorry about that. Can you send Andrew, how you would like that recommendation worded, please?
Yes, ma'am. I just texted to
You
him.
get a chance, and do you have a bill like that to put in?
I've spoken to the chairman of the Ways and Means Committee and the members, all the ones that I can get to with the Ways and Means Committee, and I floated it out there, and we're seeing how that would work.
Okay. Better you than me to have to go to Ways and Means. And so I really appreciate that. So maybe we can come in with several ways to go after this. Thank you for being on the study committee. And I'm sorry that I didn't realize that you were on. So thank you for participating.
I want to thank you, the committee, Madam Chairman, for spending the time to really delve into this thing and bringing it to light. It's one of those things that it's a silent killer. It does things over a long period of time, and it's an extraordinary cost to our taxpayers, and they deserve better than that. So thank you.
No, you're more than welcome. And I truly, this is bipartisan. Representative Stevens is a pharmacist down in the Savannah area, came in sort of like he's a longtime member. I think he came in just about half a year after I did, and has been a real contributor, and he has worked on this forever. And then he's a Republican, and then Representative Al came along, and she's a Democrat. I think there's more cooperation on a lot of issues than people usually see, because those of us that do it, we don't make the press because we're not as exciting when you get into the ones that disagree, and that's what makes the press. So we are trying hard to improve the lives and the healthcare. I mean, my thing is, you can lose everything. You can lose your family. Hopefully you won't lose your faith, whatever that is, but you can. But if you lose your health, it's over. And so healthcare is so very important to all Georgians.
And I practiced at the Mayo Clinic, trained there up in Rochester, and their motto was the needs of the patient come first. And that's the number one thing.
You sure they didn't have some Catholic nuns there too? Because that's
They
what.
did St. Mary's Hospital.
Thank you.
Yeah, and even when I went there for fellowship, the nuns were still the administrator of the hospital.
Well, and it was the patient came first, and you better take good care of them, or you were in real trouble.
Exactly.
And they could be really nice, but they could also be really mean.
Yeah, they kill you with kindness, and then they go for the jugular the next day. So
The other way around. So it was an interesting experience to train under the nuns in school of nursing back in the day. And we got any other questions for the physician? I cannot tell you how much we appreciate you bringing us information to give a positive shout out to our medical school. Somebody recently wanted to know why we didn't have more medical schools and all. Well, somebody told me once that we were just a little sleepy state that you pass through going somewhere else. And we really were very slow growing till about 10 or 15 years. And then we became the fastest growing state east of the Mississippi. And we just had a lot of catching up to do as far as starting medical schools and dental schools. And now we need a vet school.
Yes.
In South Georgia, for people that are interested in taking care of big animals, because we still are an agricultural school. So
and what's so great about MCG, 95% of the students have to be from Georgia. That's state law. So which is great because they'll go back and do rural surgery in Americus, so Cordell, or they'll do their family practice because they do those rotations during their residency. And so it really gives back. And so it's been fantastic. So
well, and for so long we didn't have the residencies here. I mean, there was a moratorium on the federal level paying part of it. And I think at the time we looked at that, a residency was about $140,000 a year by the time you paid for the faculty and all the regulations. And so there weren't a lot of our hospitals willing to step up and help pay a portion of that. They have found out how valuable it is to have the residents. I was amazed. We've been traveling, seeing some of the hospitals in South Georgia. Debbie, you were there. And all of a sudden, Albany has decided, if we'll build it, they'll come.
yes.
They redid a building, and nursing students can live there. Really nice apartment, $800, utilities paid, and made to where two students could share it. And if they stay and they'll sign a thing for 2 years to nurse after they get out of school, it's free.
Yeah.
And they built a residency, really nice, where a resident can bring their family, have low rent and, the utilities paid and everything, and do their residency there. So, I mean, the hospitals have been stepping up across our state with more residency so that the kids wouldn't graduate from our schools, go north or go west or wherever, and meet somebody out there to marry that wants to stay in their home state, or, they get to know the doctors that they're practicing with, and they get invited to stay in there to come and be a member of their group, and they don't come home again. So
And you build that collegiality during residency, and then they're going to refer you patients, and it's great for the community and for everybody involved.
So we're really trying to up that. So thank you for everything you've done. You will be hearing from us. Michelle, we'll just get with me, and when we can get that, and
We'll talk.
we'll
Yeah, and we'll drive it's only 45 foot long, so we don't need a commercial driver. So if you can help me, we'll drive that up together from down in Augusta, and we'll pull it up front.
I don't think you want me driving, but I'll ride with you to keep you company. So anyway, thank you again.
Right there. We'll get the contact info and we'll look out for the.
To come
Thank you
back.
very much.
And I'll relay that to the speaker that it's coming, that we really want to do this. And thank you very much.
Well, and the second reason it was great to come, because I haven't eaten at the varsity for a long time. So before I head back to Augusta, I'm going to my wife's a dietitian and diabetes educator. I eat very well at home, but I'm on the road. It's me.
Well, my husband used to say when he was in school, in medical school, he was so poor that he couldn't afford to eat at the varsity. And then when he got out of medical school and he got enough money, he couldn't afford because of, keeping his weight off and everything to eat at the varsity. And so that was a real rare treat. So have a good time, and hopefully you won't get screened to see about your arteries for long enough for it to get out of it. So thank you very much. Do we have anybody else that wants to speak? Okay, it's up to us. So think we pretty much, I will say, if we're going to go out at this, let's talk about trying to do it in a bipartisan way. But especially on the vaping thing, but with who all signs on to a bill.
Yes, of course.
Okay,
We
and
always like to be bipartisan. It helps make it more
That's what you're
successful.
working with.
I,
Yeah.
The numbers are there.
I was trying not to say that, Debbie, you can tell we've been together. I mean, Debbie's, all of us have been around here a long time to learn how to work the system. And if we're going to put together a bill, let's keep it separate. If we're going to do least on the vaping, if we're going to do anything about, sales, do it separately, and let's just take away the flavors. Let's let them all stand separately so we can see if we can get anything through. What?
Two other policy pieces
Okay.
that we discussed last time that we can also discuss
Okay.
as standalones is one with respect to ingredient disclosure that I think
Ah.
Dr. Hawkins was very interested in.
Right.
In terms of how we display what's in the vaping fluids and making it transparent for the consumer.
Right. Okay.
I think that's maybe something good that maybe Dr. Hawkins wants to run with since he had interest in that. Second thing was that we talked about the licensing fee for retail for who gets to sell tobacco products like cigarettes and vaping. And we learned that in this state that it's only $10 for an individual retailer to be able to sell cigarettes, which is obviously astoundingly low.
Yeah.
And an additional $10 to also sell vaping products. So that might be a
And so
good.
that's a licensing fee.
Yes, correct.
Okay.
A licensing fee. So I don't know. Yeah.
Comment about that?
Yes, sir.
There's more vape shops now in Georgia than Chick-fil-A and Starbucks combined.
Wow.
So they pop up anywhere for $10.
For $10.
I mean, it's just incredible how they've exploded.
Right.
And
So,
it doesn't cost many.
right. So it's very inexpensive. Like the
Okay.
threshold for entry is quite low and the costs to the state are quite high. So there's a mismatch there. So maybe
Okay.
something that we can look at.
Okay. No, that sounds like since it is that low and they are on every corner. And do I remember, was there a bill? Did it move something about, was it the vaping shops, how close to schools they could be?
That was a City of Atlanta ordinance that they passed just recently with
Okay.
respect to the radius around schools where you could open up a vape shop.
Okay. But just for the city.
That was a city ordinance, but we could certainly discuss it on the state level.
Okay. All right.
Yeah.
But one of the things, certainly, if it was the fee would certainly be at least a deterrent. I take it would be a yearly fee, wouldn't it? To be able to work would maybe be at least some sort of a deterrent,
Mhm.
but because it's becoming such a problem in our schools.
Now, would that fee be regulated by the Secretary of State's office or the Department of Revenue? Do you know, Andrew?
I believe it's department.
Okay, so the DOR, I'll have to chat with them about what makes sense and how to.
Do we know if other states do it as a flat fee or is it based on percentage of sales
For the,
license?
I'm not entirely sure. I can learn that.
Yep.
It's really.
Can you come forward so we can get it on? It can go out and tell us who you are.
Hey, Dana Thompson with the Lung Association. Good to see you all again. I know we had this question come up and I have done some research. It's different in every state. And some states, it's a one-time fee. The renewal fees vary. So I know that we have worked with coalitions that say that $300 should be the threshold.
How
While
much?
we're at 300,
Okay.
that can really make an impact. So that's kind of what we would recommend. But I tried to put a chart together and there was no way to make any correlation because it's different.
You'd have 50.
It is. It's so different in every code. Yeah, every state code. So
Do you have, okay, just now I want to ask a question. Yeah. Okay. Do you have any research about the states? If they're popping up all over Georgia, do you have, anything on if they're popping up all in all the other store, or the higher the fee, the less of the places that sell it, or anything like that, the number?
I could dig into that. I haven't seen, but Tobacco 21 probably has some good data on that. Yeah,
Okay.
that we can pull. Yeah.
All right, thank you. Could you just tell us who you are?
Yes, Laura Bracy with the American Heart Association. And I just wanted to piggyback on this tobacco retail license because right now in our state, we also do not require compliance checks at vape shops. The age to purchase tobacco products in our state is 21. Kids actually shouldn't have their hands on them. What we would recommend is have that go to some compliance check threshold. So every vape shop has a compliance check. Our data shows that 75% of people who go in they're not carded. So the compliance checks would also really help to keep these products out of kids' hands.
Can we? Okay. I don't know whether we can. All the money, unless it's a constitutional amendment, goes into the general budget. That's why HOPE is so good, is because, there was a constitutional amendment that said the HOPE has to be only used and it doesn't go into the general budget. That's why ours is pretty much the most successful in the country. Because the ones where it goes in the general budget, they say they're going to up the money for education. It never gets up. We would have to check on that, whether we can.
It can't be designated.
That's what I thought. That's what I thought. So we couldn't do that, but we could ask that we get the
But to
checks.
prevent youth from getting these by adding compliance.
Compliance would be,
Increasing it, I'd be okay with it going to general fund.
well, if we can just get it so that they'll get compliance officers, that would be the thing. Okay. I mean, but we try.
Yeah. You'd have to have more of you'd have to have 120 votes.
Yeah, I know. So we won't get that. So likely
It'd be better to just pass it.
just pass it,
Allocate.
the money from for compliance officers. Yeah. Okay.
Good. Hello. Really short comments. Again, my name is Fabian Antoine Nasser. I am with the American Cancer Society Cancer Action Network. One of the things I didn't hear about recommendations, and one thing I want to uplift again, would be the shutting down of the Georgia Tobacco Use Prevention Program. We know from the Center of Disease Control and Prevention that there are fact-based recommendations that a comprehensive tobacco control program provides states with the needed framework to educate people on the dangers of tobacco use, as well as connect people who are already addicted to tobacco to resources to help them quit. Unfortunately, on May 30th of this year, as you guys know already, this program was shut down here in Georgia. And overall, for every $1 spent on comprehensive tobacco control programs, states receives up to $55 in savings from averted tobacco-related healthcare costs. So we would love to see this, whether it's represented within any legislation specifically geared towards the tax, to see how we can get this program up and running again. I think if we don't have it running, it's going to have adverse effects on Georgians.
Okay. Ask what the rationale, did the feds give a rationale or just close it?
Budget cuts,
Well,
CDC budget cuts,
I
but
mean,
yeah.
what?
Doge.
Okay, then, but no, I mean, like, there was no thing that they didn't think it was working, too much money went to it.
It was not a priority
Wasn't a high priority, whatever.
for the administration.
Okay,
Yes.
what?
They were federally funded positions through the Office of Smoking and Health.
Mhm.
So that's why the department was let go.
So my question was, do you know what that cost was that the federal folks cut?
2.1 million a year.
0.1 million.
We were only at 2% of the CDC recommendation.
Exactly.
So, in terms of a policy piece, what I would imagine we would discuss as a body is, if this is a priority for us, which I think it should be because it does save our state money in the long run, is whether, as opposed to a bill, to discuss it as a investment through the budgeting process, if to cover the 2.1 million that we lost from the federal funding.
Okay, and what did you say, we were only at 2% of something, or what was it?
CDC recommends a certain amount of money. funding, and we were only at 2% what was required.
The recommendations from the CDC.
Did it already.
Yes.
Okay. And now that's gone.
Yeah, even though we
Yeah.
had that, I mean, we've decreased our smoking rate tremendously in this state from just $2 million.
Exactly.
So we could do so much more maintains, and double that would be very
Okay.
nice. Which,
Thank you very much.
You're welcome.
Anyone else who wants to? Okay, so let's, if y'all want to give Andrew the recommendations, and then let's look at this before we drop legislation. Like that, so that we can,
We can't even.
I know, but I mean, we'll work on it and see where we can go from there. Okay, you ready? For it, Andrew?
Yeah.
Well, and with that, I mean, certainly something near and dear to my heart, and everybody on this committee, Representative Stevens and Al and Debbie, and we are all would like to see the state move forward on this. I mean, a life saved is important, not just to the person, but to their families, to our economy, since it hits people, especially so many people during their working years, maybe in the 50 to 60 range when they're hitting perhaps their highest and getting ready to retire and all. So thank you to everybody that participated. We can see if we can't move some legislation.
How is it going to work with the study committee report? Okay.
And yeah, and we'll look forward to seeing the mobile unit sometime in January. This is the second year. It's not a first year when we start off slowly because there's no new, you only have to wait till everybody gets new legislation in. And so we already are sitting on pieces of legislation now. So it does start off faster, which is sometimes good and sometimes not so good. But, you know, around February or something, early February or something, whatever, you know, we can get to work. We'll look forward to having that.
What we found with the blood drive is that obviously people's capacity to pick up extra things decreases as the session goes on. So we have better uptake closer to the beginning of session before the
Late
movies
January.
start piling up. So maybe even late January would be a good time.
I mean, I hope you don't have a pair of dirty lungs or anything for me to carry around, like you carry the blood drop around. So she goes with her little blood drop, and, you know, I've helped her carry that down for everybody. Please go, don't donate blood, but
yeah, so, and if everything goes well, we'll do the wrap on the bus with your pictures on it.
oh,
So
I don't think so.
when you come to the state, and we'll just rotate that wherever you are.
Yeah, right.
That would disincentivize people for.
Yeah, right, from doing it. So anyway, so thank you, everybody. We are adjourned.
Introduce myself. I'm looking at that with the Lung Association.
I just said you're gonna speak it.